The text from my brother came at 6 a.m. on a Tuesday. Big awards ceremony Friday night. You need to be there. I'm getting the Young Physician Excellence Award. The whole family is coming. No excuses this time. I stared at my phone, lying in bed with my PICC line taped to my arm, the pump quietly delivering continuous chemotherapy. Friday was day 6 of my current treatment cycle. When nausea peaked, when blood counts bottomed out, when sitting upright felt impossible. I typed back, "Ryan, I'm in the middle of a chemo cycle. I'll be too sick." His response came immediately, "You're always too sick. You've missed every important event in my life for the past year. This is the biggest night of my career. Be there or don't bother calling yourself my sister." At 34, I was 2 years older than Ryan, but you'd never know it. Ryan was the golden child, cardiac surgeon at prestigious Mercy Hospital, married to another surgeon, featured in medical journals as a rising star. His Instagram overflowed with operating room photos and awards. I was the problem. The graphic designer working from home, building brand identities for Fortune 500 companies. I made excellent money, more than Ryan, but my family saw me as the underachiever who never left her apartment. What they didn't know was that I'd been anonymously funding Mercy Hospital's cancer research program for 3 years. $500,000 annually. My donations funded clinical trials, purchased imaging equipment, and established patient assistance programs. They also didn't know how sick I actually was. Stage 4 pancreatic cancer. Diagnosed 18 months ago with a 5% 5-year survival rate. I'd undergone surgery, multiple rounds of chemotherapy, and was currently on an experimental treatment protocol. "Sarah's always tired," my mother said when I missed family dinners. "She's being dramatic," Ryan said when I tried to explain why I couldn't travel to his conference. They knew I had cancer. I'd told them at diagnosis. But Ryan, with his medical degree and surgeon's ego, had decided my treatment was overblown. "Pancreatic cancer has improved survival rates now," he'd said dismissively. "You're probably just stage 1 or 2. You'll be fine." "I'm stage 4, Ryan. It's metastatic." "Are you sure? Did you get a second opinion?" Sometimes oncologists are too aggressive to justify expensive treatments. I'd gotten 4 opinions. All said the same thing. Advanced cancer, poor prognosis, experimental treatment was my best shot. "Sarah's always been a hypochondriac," Ryan told our parents. "She's probably making it worse than it is for attention." Over 18 months, Ryan had missed every chemotherapy session, every surgery follow-up, every emergency room visit. But he expected me at every single one of his events. "You look fine," he'd say when I showed up pale and weak. "See? You're not that sick." What Ryan didn't know was that the chief of surgery at Mercy Hospital, Dr. Patricia Morrison, was my oncologist's closest colleague. She'd personally reviewed my case file when I enrolled in the experimental trial. She'd called my situation one of the most challenging pancreatic cases she'd seen. She'd also asked me multiple times to speak at Mercy Hospital's cancer fundraising events. I'd declined, wanting to keep my donations and illness private. But she knew everything. And Friday night at Ryan's awards ceremony held at Mercy Hospital, she'd be there. As chief of surgery. As the person who approved department funding. As someone who didn't tolerate physicians who lacked empathy. I decided to go. Not for Ryan. But because I was tired of being called dramatic by someone who'd taken an oath to heal. Hold up. Friday evening, I forced myself into a dress that hung loose on my 70-pound lighter frame. I'd lost my hair months ago. I didn't bother with a wig. I wore a scarf, applied makeup to hide the gray pallor, and tried to ignore the nausea. The ceremony was in Mercy Hospital's conference center. 200 doctors, administrators, and donors filled the space. My family sat at a front table. My parents, Ryan, his wife Jessica, and 2 empty chairs. "Sarah, you actually made it." My mother hugged me carefully. "Hook, well, you look sick, honey. Are you sure you should be here?" Ryan said I had to be here. "Well, yes, but maybe you should have stayed home. You're making people uncomfortable." Making people uncomfortable. By existing while sick. Ryan spotted me and rushed over, his face tight with anger. "What the hell, Sarah? I told you to make an effort. You couldn't put on a wig? You couldn't try to look normal? I'm on chemo, Ryan. This is what I look like." "You're embarrassing me," he hissed. "This is my night. The hospital board is here. My colleagues are here. And you show up looking like that. Like a cancer patient? Like you're trying to get attention. You always do this. You always find a way to make everything about you and your health issues. You demanded I come. I came. I thought you'd at least try to look presentable. God, Sarah, can't you just be normal for one night? He turned to our parents. See what I mean? She does this on purpose. Makes everything about her cancer so she can be the center of attention. My father looked uncomfortable. My mother nodded. Ryan has a point, dear. This is his special night. The ceremony began. Hospital CEO gave a speech about excellence in medicine. Then came Ryan's award. Dr. Ryan Chin has demonstrated exceptional skill in cardiac surgery, compassion for patients, and dedication to advancing cardiovascular medicine. Ryan walked to the stage beaming. He accepted his award, then took the microphone. Thank you to Mercy Hospital for this incredible honor. I've dedicated my life to healing hearts, to giving patients hope, to treating every person with dignity and compassion. I almost laughed. Compassion. Medicine isn't just about technical skill, Ryan continued. It's about empathy. It's about understanding suffering and responding with kindness. It's about seeing the whole person, not just the disease. I learned this from my family. My parents taught me hard work. My wife supports me every day. And my sister, he paused, gesturing at me, reminds me that not everyone handles adversity with grace. Some people let challenges define them. As physicians, we have to help patients move beyond that mindset. The audience applauded. My mother dabbed her eyes. I sat there, nauseous and weak, listening to my brother use me as an example of how not to handle illness. In front of 200 medical professionals. Then I saw her. Dr. Patricia Morrison, chief of surgery, standing near the back. She wasn't applauding. She was staring at me, her expression shifting from confusion to recognition to absolute fury. She started walking toward our table. Revelation. Dr. Morrison reached our table just as Ryan returned from the stage. She looked at me first. Sarah? Sarah Chin. Yes, Dr. Morrison. Ryan's head snapped toward us, face pale. Dr. Morrison. Thank you so much for this award. Dr. Chin, she said coldly, is this your sister? Yes, this is Sarah. She's your sister Sarah Chin. The stage 4 pancreatic cancer patient enrolled in our experimental protocol trial. The table went silent. My parents stared. Jessica's mouth fell open. Yes, but, Ryan stammered. The Sarah Chin who has been anonymously funding our cancer research program for 3 years. $500,000 annually. The donations that funded your department's new cardiac imaging equipment, Dr. Chen. Ryan's face went gray. What? Your sister has been one of our hospital's largest donors. She's funded clinical trials, purchased equipment, and established patient assistance programs. All while undergoing treatment for one of the most aggressive cancers we see. He turned back to me. Sarah, I'm so sorry. I didn't know Ryan was your brother. I was in the hallway. I heard what you said to her about looking sick. About making everything about her health issues. About seeking attention. Dr. Morrison, I didn't mean, Ryan tried. You told your sister, who is dying of stage 4 pancreatic cancer, that she was embarrassing you by looking like a cancer patient. You used her as an example of not handling adversity with grace in your acceptance speech. Nearby tables had gone completely silent. People were listening. Jessica looked horrified. My parents sat frozen. I reviewed Sarah's case file personally, Dr. Morrison continued. Do you know what stage 4 pancreatic cancer means, Dr. Chin? You know the prognosis. You know the survival rates. You know your sister is fighting a terminal illness with experimental treatment as her only hope. I thought she was exaggerating, Ryan started. You thought your sister was exaggerating cancer? Did you review her medical records? Did you talk to her oncologist? Did you attend a single appointment with her? She never asked me to. She shouldn't have to ask. You're her brother. You're a physician. You took an oath to heal, to show compassion, to relieve suffering. Instead, you've spent 18 months telling her she's being dramatic while she's literally fighting for her life. Ryan's hands were shaking. Dr. Morrison, please, this is a misunderstanding. Is it? She pulled out her phone. I'm looking at notes from last week's hospital board meeting. We discussed a significant anonymous donation that sustained our cancer program. Surgeon. Your sister. The same sister you just publicly humiliated for looking sick while undergoing chemotherapy. She looked around at the watching crowd. Let this be clear. Dr. Ryan Chen's award tonight was partially funded by equipment purchased with his sister's donations. Equipment he's been using in his cardiac surgeries. Equipment that wouldn't exist without the generosity of a woman he's been calling dramatic and attention-seeking. Sarah, tell her this isn't. Tell her I've been supportive, Ryan said desperately. Have you? I asked quietly. Have you visited me during treatment? Called to check on me? Attended a single doctor's appointment? Or have you just told everyone I'm exaggerating? He had no answer. Dr. Morrison turned to the hospital's CEO, who'd approached during the confrontation. We need to discuss Dr. Chen's conduct. This represents a fundamental lack of compassion. My office Monday morning, the CEO said to Ryan. Bring documentation of your sister's condition if you still believe she's exaggerating. Dr. Morrison looked at me. Sarah, would you come with me? I'd like to get you somewhere quiet. As we walked away, I heard my mother's voice. Ryan, what is she talking about? Stage 4. $500,000. She did tell you, I heard Jessica say quietly. You just didn't believe her. Resolution. By Monday, the story had spread through Mercy Hospital. The hospital board launched an investigation into Ryan's conduct. They interviewed me. I provided my complete medical history. Diagnosis, treatments, prognosis, complications. I showed them donation records. 3 years of funding, all anonymous until now. I told them about every missed appointment, every dismissive comment, every time Ryan had called me dramatic. The board also interviewed Ryan's colleagues. They found a pattern. Nurses reported he was dismissive with patients who complained of pain. Patients had filed complaints about him minimizing their symptoms. Dr. Chen appears to have a fundamental blind spot regarding patient suffering, the report concluded. If he cannot recognize serious illness in his own sister, his judgment with patients is questionable. Ryan's department funding was cut by 40%, the amount my donations had contributed. His award was quietly revoked. He was placed on probation and required to complete remedial training in medical ethics and patient compassion. My parents called after the investigation. Why didn't you tell us how sick you really were? My mother asked. I did tell you. Ryan told you I was exaggerating. You believed him. We didn't know. You didn't want to know. Ryan sent one email. You destroyed my career over hurt feelings. I didn't respond. But Dr. Morrison did. She forwarded me her reply. Dr. Chen, your career was damaged by your own lack of empathy, not by your sister's honesty. Medicine requires compassion. You demonstrated none. 3 months later, my experimental treatment showed signs of working. My tumors had shrunk. You're responding better than we hoped, my oncologist said. You might actually beat this. Dr. Morrison asked me to speak at Mercy Hospital's cancer fundraising gala. This time I agreed. I stood in front of 300 doctors, donors, and board members and told my story. I funded cancer research while my own brother told me I was being dramatic about having cancer, I said. I donated $500,000 annually while undergoing treatment my family didn't believe was necessary. I did it because other patients needed hope, needed research, needed support. Even if my own family couldn't provide it. The audience was silent. Cancer reveals who will stand with you. My medical team stood with me. Dr. Morrison stood with me. My family didn't. But I survived anyway. And I'll keep funding research so other patients can survive too. Because we deserve to be believed. The standing ovation lasted 5 minutes. Donors pledged an additional $2 million that night. Ryan wasn't there. He'd left Mercy Hospital, taking a position at a smaller facility. His probation followed him. His reputation was permanently damaged. 1 year after that award ceremony, I was in remission. Against all odds, the experimental treatment had worked. I'd beaten stage 4 pancreatic cancer. Dr. Morrison threw a small celebration. My oncologist was there, crying happy tears. The nurses who'd supported me through treatment were there. My real family, chosen not blood. You did it, Dr. Morrison said. You survived what most people don't. I survived because you believed me, I said. Because you saw me when my own brother wouldn't. I still fund cancer research at Mercy Hospital. 500,000 annually, no longer anonymous. My name is on the donor wall now. Right next to the cardiac surgery wing. The wing that uses equipment purchased with my donations. The wing where Ryan used to work before his lack of compassion caught up with him. I don't regret going to that awards ceremony. I don't regret letting Dr. Morrison expose the truth. Because somewhere, there's another cancer patient being called dramatic by their family. And maybe they'll hear my story and know, you're not dramatic. You're not exaggerating. You're surviving. And that's everything. The hospital named a patient advocacy program after me 6 months later. The Sarah Chin Compassionate Care Initiative trains medical residents to recognize when they're dismissing patient concerns. Ryan's case is used as a teaching example. Anonymized, but everyone at Mercy knows the real story. I mentor newly diagnosed pancreatic cancer patients now. Last week, a woman came to me in tears. My family says I'm being dramatic about my treatment, she said. My sister's a nurse and she keeps telling me I'm overreacting. I held her hand and told her about Ryan. About the awards ceremony. About Dr. Morrison's intervention. Medical degrees don't make people immune to cruelty, I said. Sometimes the people who should understand suffering the most are the ones who deny it hardest. She cried with relief. I thought I was going crazy. You're not crazy. You're sick. And you deserve to be believed. 2 years post-remission now, I'm healthier than I've been in years. Ryan reached out once asking if we could move past this. I didn't respond. Some bridges aren't worth rebuilding. But every patient I help, every donation I make, every life saved by research I funded, that's worth everything. Ryan got his award. I got my life. I know which one matters more.